0956 660 KBN TV, the finest television on channel 279 DSTV and channel 102 on Topstar.
There cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience. Hello, a lovely good evening and a warm welcome to our fifth episode of the Inside Health TV series program right here at KBN Television. This is a program that discusses various health issues that are affecting Zambians and beyond. It is brought to you every Sunday from 20 to 21 hours by the Zambia Association of Gynecologists and Obstetricians, ZAGO, with the support from the International Federation of Gynecology and Obstetrics, FIGO. I'm your host, Tumenje Chinjili. This evening, we'll be discussing maternal mortality. A lot of women in Zambia are dying while giving birth from various complications. These cases unacceptably high, especially among young girls or other adolescents between 10 and 19 years of age. The World Health Organization, WHO, indicates that in 2017, Sub-Saharan Africa alone accounted for roughly 2/3, which is 196,000 of maternal deaths. These figures are alarming to say the least. Zambia has continued to lose a lot of lives from birth-related complications. It is for this reason that the Inside Health program this evening will be discussing this very important topic to understand what maternal mortality is, what causes it, and how, as a country, we can prevent this problem. A lot of young women and girls' lives can be saved through this. We are a firm believer that no woman should die during giving birth. Well, to help me discuss and explore more about this topic, I've been joined in the studio by Dr. Jean Chirwa. Doc, welcome to the program, and it's great to have you here. Good evening.
Good evening to Menji, and good evening to our viewers, and thanks for having me.
Remember that we are live on ZAGO and KBN Facebook pages, as well as YouTube channels. You can also call or text us on the number that is showing. The number is 0956 20 81 08. The number is right on your screen there. You can be part and parcel of this program. You can call us, you can text to ask the questions that you have, and also make the contributions that you might have. Please stay tuned and don't go away as we are getting straight into the program, as we are trying to understand more about this problem. So Doc, I know you've already been here before, so we are just going to go straight into our program this evening. So Doc, to begin with, what is maternal mortality? What do we mean when we talk about maternal mortality?
Thank you so much to Menji for that question. I'm just glad to be here and just to discuss this really important topic that we have at hand. So when we're talking about maternal mortality, really, I'm sure a lot of viewers are wondering, what is maternal mortality?
Exactly.
Just to break it down, or to put it simply, maternal mortality is basically death of a woman. So now, what kind of a particular woman are we talking about? So death of a maternal mother or an expecting mother is basically death that occurs when a woman is pregnant, or death that is exacerbated by a pregnancy-related condition. For example, a pregnant woman who has a hypertensive disease who gets pregnant and ends up with complication because of the existing condition, or it's death that would occur during delivery itself, or it's the death that would occur within 42 days of a woman delivering, or basically death that would occur after a termination of pregnancy, or this death usually occurs mostly within 48 hours of delivery. So it's a death that would occur when a woman is delivering, or most commonly within the 42 hours, because of related complications that we'll discuss as we go on in the topic.
So, for the sake of my viewers, could you explain what maternal mortality ratio is, and also what is the prevailing maternal mortality ratio in Zambia at the moment?
Okay, so when we're talking about, again, now we're talking numbers, right?
Yes, yes.
Yeah, so basically where we stand right now, according to the Zambia Demographic Health Survey of 2018, our maternal mortality rate is really on the high side. The statistics show that of 100,000 women delivering, we have 398 of them dying. What that means is that for every 1,000 births that are occurring, about 3 to 4 women are dying. Okay. To put that simply, you get, what's the capacity of a Marco Polo bus? 72.
Somewhere there.
Yeah, 72. So for every 100,000 women, 4 Marco Polo buses of women are dying. So those numbers are really, really high. They're very, very high. And I think that's why it's really important for us to just really just sit down and discuss and how we can curb these mortalities from occurring.
In detail, could you explain to the viewers the major causes of maternal mortality? As you had earlier said that there are some of the conditions that result to the death. So what are they really?
So when we're talking about these deaths occurring, there are basically quite a number of reasons why they occur, but I'll simply focus on at least the most common ones that would lead to it. And I think it's important for our viewers to understand this very well and to also get the background as to why it's important for our women to seek health care upon discovering that they're pregnant, because it's through the antenatal screening and through the antenatal attendance that we're able to identify at-risk women and also to carry out measures that would prevent adverse outcomes from occurring. So the most common causes of maternal mortality or maternal death or death of a mother during delivery is bleeding. Okay. And why are we having so many women bleeding? The bleeding can occur because of so many reasons. And the most common that we have noted is women who are delivering from home. They have no experienced person to help them deliver. So they end up with products of conception, or part of the products that were supposed to be expelled after delivery, such as the placenta, or the uterus is not contracting well, so the woman will end up bleeding excessively. That's not to mean that that does not happen, or it only happens to women who are delivering from home. No, it happens also in the healthcare facility. And how does that happen? It happens maybe because a woman has had multiple pregnancies, twins. A woman has delivered. Has had several deliveries before, a woman has a blood disorder, or the woman has had returned products of conception remaining, and these women end up bleeding. However, if this is happening in the hospital setup, there are measures that we do put in place, okay? But then also you'll find that because of a woman bleeding too much, they'll need blood, which, for example, at that particular moment will not be occurring depending on the facility that the woman is delivering from. So that's like one of the causes. The other cause is infections. You know, like I mentioned, there are women delivering from different health centers. There are women delivering from home, and once that delivery has not been conducted in a hygienic manner, a woman would end up with an infection. And just because we're talking about infections, we can mention other conditions such as malaria that can occur, such as tuberculosis. You know, all those are leading causes of maternal deaths. Then other issues we can focus on, and I think it's important that we dwell a bit of some time on this, is hypertensive disorders. What do I mean when I say hypertensive disorders? what I mean is a woman who has developed hypertension or high blood pressure in pregnancy. So for us in the hospital setup, we want to ensure that this woman comes to the hospital early. We screen them and find out whether they already have a pre-existing hypertensive disorder or a BP condition, or they develop BP during pregnancy. And you find that a woman would develop BP during pregnancy. They're at home because they are waiting to attend antenatal clinic when they reach 7 months. This condition commonly occurs between 20 weeks and 24 weeks. So a woman would develop hypertension in pregnancy and end up with complications. So this is a woman who end up with high blood pressure, starts fitting at home, and I'm sure that the community has heard that, oh, banamgira na BP pamimba, right? And they had to terminate the pregnancy, or they had to make her deliver early, because we know that basically if a woman develops this condition that we call preeclampsia in pregnancy, the only treatment is to deliver the pregnancy because there's no medication for it. So
just there, let me just get a clarity. You said sometimes pregnant women,
yes,
might develop BP.
yes,
During
high blood pressure.
pregnancy.
Let's not say BP,
Okay.
because everyone has BP, maybe high blood
High
pressure.
blood pressure.
Yes, please.
So is this high blood pressure different from the one that maybe just a normal regular person has? What's the difference there?
Okay.
Because you said one develops high blood pressure during pregnancy sometimes.
Yes.
So what's the difference there?
Okay, so the difference is basically the cause of that BP. Okay, so the general population would have hypertension, which could be caused by various conditions. For example, a woman could have BP because of a cardiac condition or a heart disease, because of a kidney disease, because of a hormonal imbalance, okay, because it's hereditary, like it's been passed on, because of problems to do with the pituitary gland and things like that.
Okay.
But the BP that develops during pregnancy is a BP that is coming about because of certain changes that have failed to take place in this woman. So when a woman is pregnant, there are adaptive changes. The body adapts to this kind of environment. So it has to undergo this transformation in order for it to accommodate this growing pregnancy. So now what happens once these adaptive measures have not taken place? The woman ends up with hypertension. And that kind of hypertension, yes, as much as it can be controlled, but the problem that ends up happening is when the complications occur. So these complications that we're talking about preeclampsia. So in preeclampsia, this woman would have, now there's organ damage occurring to the kidneys. The organ damage can occur to the heart, it can occur to the lungs, it can occur to the brain. Okay, so they'll come in presenting with, oh, by matenda in urine, banampeza na proteins in urine. That means by then the kidneys are already getting involved. And we don't want this disease to progress, hence we deliver these women. Because the only treatment that will give them is a BP control, yes? But then the ultimate treatment would be to have this woman delivered, because that is being caused by the presence of the placenta in the body. I hope that's, simple.
Okay, Doc. Then let me also take this opportunity to ask about the condition that is called sepsis.
Sepsis, okay.
Sepsis, yes. What's that condition exactly? Because I think we just hear about it, but we don't really know what it is.
Okay, so sepsis is basically infection. Yeah, when we're talking about, nakwata septic abortion, or she has puerperal sepsis, which is infection that is occurring after a woman has developed. So this woman will present with things such as fever, palpitations, and maybe if it's a woman who's just delivered, they would have a foul-smelling vaginal discharge. Yeah.
Okay. So what is being done about the problem of maternal mortality at global level?
So at global level, I would want to discuss things like the Millennium Development Goals. So in between a period of 1990 and 2015, there were Millennium Development Goals that were set, which were targeting to reduce maternal mortality rate at 75%. However, that was not attained. I think between that period there was a reduction of about 45% of maternal mortality rate. However, the Sustainable Development Goals countdown of 2030 is aiming to reduce maternal mortality to about 140 per 100,000 live births worldwide. Now, how is this going to be achieved, and what measures are the World Health Organizations or maybe the United Nations or the World Bank putting in place? So one of the things that they've put in place is to ensure that women across the world have access to reproductive health services. And if my mind serves me right, during our last discussion, one of the things that we discussed that ZAGO is doing is to ensure that there's complete coverage of reproductive health rights of women across the country in Zambia, both the urban and the rural areas, which is one of the measures that the Sustainable Development Goals is focusing on. And secondly, the other thing that is going to ensure that there's this reduction in maternal mortality is by ensuring that the health facilities have got trained personnel, experienced trained personnel. And I'm sure as we continue to discuss down the line, we'll discover what our country is doing about it. Then also, the third point is identification of the factors that would lead to death of a woman during either delivery, after delivery, or even after a termination of pregnancy. Okay, so we found that the World Health Organization in 2004 put up some measures, and the measure they put up is introduction of introduction to the health technical systems by ensuring that there's a program that they call the maternal death reviews. In most of these health centers, you'll find what's happening is when a woman dies, it just doesn't go under the carpet. Okay, she's died, then you all move on. No. What we do is we sit down, we try and review what could have caused the death of this woman. What measures could we have put in place to prevent it? What are we learning from it as healthcare personnel? So those are some of the measures that are being put in place at a global level to try and reduce maternal mortality.
So do we have latest statistics on maternal death prevailing at the moment in Zambia? And also, how concerning is this problem?
I think we have already discussed them, and unless there's a new review, we're still standing by the Zambian Demographic Health Survey of 2018 that puts our maternal mortality still at 398, which is a really high number. You know, when a woman gets pregnant, it's every woman's desire to go back home to be joined with their family and this new bundle of joy that they've had, right?
Yes, please.
However, it's saddening to see that there are still women in this day and age that are dying during childbirth. And I think that's why we're here as ZAGO to try and educate the masses to see how best we can reduce our maternal mortality to even zero, so that there's no woman dying during childbirth. Okay, because childbirth is supposed to be a process that's enjoyed by everyone.
Exactly.
It's supposed to be a process that's going to bring joy to this family because they're being joined by someone new. But then to go back home with you come to the hospital to deliver and then you lose your child or you lose your life, that's really saddening. So what's the magnitude of that? The magnitude of that, of course, is a high impact on the cost of healthcare, because like I mentioned earlier on, there are complications that can arise that can be prevented. So now imagine you have to treat those complications that are arising. You are allocating resources to that particular cause. Secondly, the impact is also felt on the family. There's a psychological aspect of it. Imagine you lose your spouse, you lose your mom, you lose a sister, a brother who could potentially be a breadwinner for that family. Yeah, that's the magnitude is quite high. Yeah.
For those who are just joining us at the moment, please feel free to call us on 0956 20 8108. The number is right on your screen. You can send us a text, you can call, you can be part of this program by you asking the question that you might have and also sending us the contributions that you might want to send to us. Not forgetting that we are also live on our ZAGO and KBN TV Facebook pages, as well as our YouTube channels. So, Doc, just to go back to our questions, I'm aware of many health facilities the government has built across the country, yet maternal mortality is still high. Why? Why is it so? What could be the main root cause to that?
I think the main root cause to that really is it's both health facility related, or should I say health personnel or manpower related, and also the attitude of our people towards seeking or health seeking behavior. A typical example I would give you is where we see a woman who's pregnant, has stayed home because she's waiting for this pregnancy to start showing before she can come for antenatal. So it's during antenatal period that we're able to screen these women and stratify them into either a low risk pregnancy, a medium risk, or a high risk pregnancy. By that, what do I mean? You come in, we screen you, and we find there's nothing wrong. We want to assure ourselves that that's a pregnancy that will be carried to term without any complications occurring. Let's say, for example, you also come in and you have a kidney disease, you have a heart disease, you are diabetic, or you're already hypertensive. There's a way in which we'll manage you which will be different from someone who does not have those problems. But then if you sit at home and then you wait up until the end for you to come for antenatal, it becomes difficult for us to screen you or even identify you as a high risk pregnancy. Secondly, it's the issue of you've mentioned there's an increase in the number of healthcare facility arising. Yes, there are all these healthcare facilities arising, but what's the doctor-patient ratio in our country, or what's the healthcare patient ratio in our country? You find that most of these hospitals do not have enough skilled manpower to attend to these women. The prescribed WHO standard is actually one doctor to about 1,000 patients. The acceptable or ideal is 1 to 1,000 to 5,000. But what is prevailing on our ground is you find one doctor against 12,000 patients. You've seen the difference. Yeah, so the difference is so high, even the manpower is overwhelmed. So then what can we do to try and improve this? So one of the things that I think the government has done is to allow both the public and the private health sector to open up private training schools, which I think now we've seen a mushrooming of all these schools coming about, the different medical schools, the different nursing schools, to come on board to try and help curb this shortage that we have.
So, based on the explanation you've given about women coming to the health facilities to seek antenatal services,
Yes.
how early should a pregnant woman come to seek those services? At what stage of the pregnancy should a woman come to seek those services?
Tumenji, thank you so much for that question. Actually, women are not supposed to come to the hospital when they're pregnant. They are supposed to come to the hospital before they become pregnant. Why should they come to the hospital before they become pregnant? We need to ascertain that this woman is able to carry this pregnancy, which goes back now to our poor seeking health behavior. You know, in an ideal situation or an ideal country or ideal hospital environment, we're supposed to have what is called preconception counseling. So what do we mean by preconception counseling? This is the counseling or the advice that a woman gets before she gets pregnant. So we'll ascertain what kind of medical condition this woman has, what diseases are running in the family, what abnormalities are there, what conditions does she have, what medication is she taking, is she able, when she gets pregnant, to carry this pregnancy to term? If not, what measures can we put in place to prevent her from having all those problems? So now our women in our setup wait until they get pregnant then because of the traditional beliefs and myths, they want to come to the hospital when they're 5 months, 6 months. If we're not able to come to the hospital for preconception counseling, just the moment you discover that you're pregnant, you come to the hospital. Why are you coming to the hospital? Simply because of the same things that we've told you. If you're on medication that will cause harm to your child, we want you to stop that medication. And then also, as much as we want to have a healthy mother, we also want to have a healthy baby, not so? It wouldn't be right for a woman to carry this pregnancy to term only to find that the baby has no head, or the baby has got problems with abnormalities, congenital abnormalities. We want to start this pregnancy with you from the beginning, so that should anything outside the normal occur, we are there to carry you through till the end.
So is that counseling offered at all the health facilities in the country, or maybe we've got specific health facilities?
As long as there's a healthcare facility with a maternal health center, all those services are available. Yeah, it's just, it still goes back to our poor health-seeking behavior. You find that even the most educated people don't even go to the hospitals to seek these services. So it basically seems as though these facilities are not available. However, these facilities are very, very much available for us to enjoy.
Yeah.
Yeah. We're waiting for you.
I will definitely come. Okay, Doc, the government and its development partners have, over the years, been doing so much to address this problem. As some of the interventions seem to be bearing fruits, as you've already explained, the battle is far from being won. Where has been the problem? Like, you know, there are these efforts that the government is putting in place and also other partners, but we still seem to have this problem. Why is it so?
I would like to recommend the government really, Timenji, for what they are doing. I think that in as much as we are still lagging behind, we better give them a thumbs up for the job that they're doing, right? They've introduced, they've allowed both the private and government sector to open up schools. And I think also they've enabled other organizations. For example, our association, ZAGO, is able to carry out these sensitization programs with stakeholders such as the Ministry of Health themselves, right? And also, I think they've allowed specialist training programs. I'd like to mention that there's a specialist training program now that is being run by the Ministry of Health, called a specialist training program for different fields, meaning that by the end of 4 years or so, and the first group recently graduated, or they recently finished their training, we'll have a number of specialists in these facilities to try and help bring down some of the main problems that we're facing. Of course, we're far from being done, and we also are the government, so I think it's up to us to provide those checks and balances and to say, okay, how best can we prevent this from happening, or how best can we carry out these efforts in our communities? Yeah.
Interesting. We'll go on a break. Please stay tuned. We'll be right back. It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenji Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience. universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on ZAGO and KBN Facebook pages and YouTube channels. Tune in and share that health experience. Welcome back. For those that might be joining us at this moment, we are looking at maternal mortality. And please, you can call us to be part and parcel of this program, to ask the question that you want to ask, and also to give us a contribution that you might have. The number is right on your screen. You can also be part of this program by following our Facebook pages, which is KPN TV and ZAGO, as well as our YouTube channels. So, Doc, are there any roles that each one of us can play to prevent maternal deaths? By this, I mean, what role can health workers and society in general play to bring to an end this problem?
Firstly, I think on the part of the healthcare workers, which is something that we as ZAGO are doing right now, is sensitization of the public with regards to health-seeking behavior, and also preventing those practices that would cause maternal mortalities. I think ZAGO has been actively involved in sensitization programs, especially targeting issues such as unsafe abortions to prevent maternal mortality. And I think we should mention that unsafe abortions is one of the main issues in our country. It's about the 5th main cause of maternal mortality as we speak right now. So I think that's some of the things that we can do. But then also to increase public health sensitization on the need to seek healthcare services early. If they are planning to become pregnant, they come to the hospital and we do the preconception counseling. If they discover they're pregnant, they come to the hospital early so that we carry them through the pregnancy. I think that's one of the things that we as healthcare workers can do. But then also on the part of the public and at an individual or society level, it's important that we try and curtail some of the practices and the myths that are occurring in our communities. For example, the traditional myth of a woman waiting till the pregnancy starts showing in order for her to come to the hospital. I think that's something that everyone can talk about. You know, there's really nothing wrong with you coming to the hospital just the moment you discover. So we need to dispel such myths, and also to ensure that we are actively involved as families and as societies. Because to be honest, once you have a strong family support system, or you have a community that is highly sensitized, which is where we are bringing in different stakeholders as ZAGO, you find that we are not doing this fight on our own. Like I think we mentioned in our previous program to say we have different stakeholders. We are working with the Ministry of Higher Education, we are working with the Ministry of Health, we are working with the traditional leaders, we are working with religious groups, we are working with the chiefs in the different communities, and we are also working with the youths. So once we have this information, you know, they say knowledge is power.
Exactly.
Yeah. So once we have this information and we know what healthcare services we can obtain from the community, and we sensitize each other, you find that the maternal mortality rate will really drastically reduce. Yeah.
So, as you had explained earlier, to say the ratio that's there, doctor to patient or nurse to patient, the ratio is quite poor. And also looking at other challenges, especially in rural areas where I think our health facilities are not so, do not really provide quality health services. Do you think as a country we're on the right track in addressing this problem of maternal mortality?
I think we are on the right track of addressing maternal mortality, because when you look at our previous statistics to where we are now, of course there's been a reduction. I think that's something that's commendable. However, we're not at a level where we can be satisfied to say, okay, we've done our part. I think more still needs to be done. Um, However, I think it's important, like I mentioned, that we all work together. It's not a fight that we can just leave to the health workers. It's not a fight that we can just leave to the government alone. It takes you as an individual to be deliberate about your health in order for us to reduce this. And once we work together, you eventually the maternal mortality rate will reduce.
A few weeks ago, we were discussing ZAGO's project aimed at preventing unsafe abortions in the country. Is there any connection between unsafe abortions and maternal death? And if it's there, how so?
I think we've discussed earlier on to say one of the main causes of maternal mortality is unsafe abortions, amongst other causes. So, what these unsafe abortions or these unsafe practices lead to a lot of things. When a woman decides to abort on her own, or decides to get an abortion from the auntie that lives across the street, or uses whatever unsafe methods that are there to just get rid of this pregnancy, there are so many things that can occur, which takes us back to the five main causes that we've already discussed. These unsafe practices can lead to bleeding, because you wouldn't have expelled everything. So what happens when a woman loses a pregnancy is we clean them to ensure that everything has been removed. Because if things are not removed, this uterus will not be able to contract. And what happens when this uterus is not able to contract? This woman can bleed to death. Okay, so these are the women who are home, they are bleeding, they keep on bleeding. By the time they're coming to the hospital, they're pale, they have no blood, they're anemic. Okay, and then there are all those consequences of anemia that can occur in this woman. And also, because of these unsafe practices, you find women in the hospital, once this abortion is carried out, it's carried out in a sanitary or hygienic environment, right? Now, if you are going to get a kitchen knife or a spoon or a hook or a wire, a West steel cassava or a
Cassava
bottle,
stick.
cassava stick or a bottle to insert just to get rid of that pregnancy, you develop a condition called sepsis that we had mentioned earlier on,
Exactly.
and you have all these other problems coming along with it. So yes, we as ZAGO, as advocates of not only prevention of unsafe abortions, but also advocates of safe choices, are here to ensure that our women know their reproductive health rights. Like I mentioned earlier on, it's our mission and our mandate to ensure that every woman out there has access to their health, reproductive rights and choices. I'm wearing this t-shirt that's saying safe choices. Yeah,
See,
so a woman has the right to decide what she wants to be done to her body. A woman has a right to choose when she wants to get pregnant. If she doesn't want the pregnancy, she has a right to decide to either terminate it or to continue with it. So yes, we're carrying out this sensitization message as one of the areas in which we have identified as a main cause of maternal mortality ratio. Um, just to mention, UTH, our hospital has got a CO3 ward or a gyne ward. You find that three-quarters of the women who are coming in because of unsafe abortions. So you find our bed space has got over 50 to 70% of women who are coming in from with these unsafe
is
abortions.
it so?
Yes, it is. So our job is to ensure that these women are sensitized and those numbers are reduced. Yeah.
You've really put an emphasis on women coming to the health facilities to seek maternal health care.
Yes.
So generally, what does maternal health care include?
Maternal health care simply means the well-being of this woman who's either pregnant. So when we're talking about maternal, basically we're focusing on a woman in the reproductive age group. A woman who wants to conceive, who has already conceived, okay? So even when we're talking about maternal mortality, we're not focusing on deaths that are occurring from accidents. No, we're basically focusing on on pregnancy related issues. So maternal health is a comprehensive well-being of this pregnant woman or this woman who's carrying a child. Yes, so we need her to be in a state of complete physical well-being, mental well-being, social well-being, financial well-being. If there's a derangement in any of that aspect, not to say that when you come to the hospital, Timendi will give you money because you have a financial problem. No, but we want you to be in a state of health where you'll be able to carry your child to term without any complications. Yeah, not just carrying the child, but also delivering a healthy child.
So that also includes postnatal.
Yes, that also includes a postnatal period up to about 6 weeks. Thereafter, you are outside our care.
So is there anything ZAGO is doing to reduce maternal health deaths in the country?
Yes, there's a lot that ZAGO is doing. For example, I think we've had high media sensitizations with regards to issues that high in terms of causing maternal mortality. ZAGO is running also other programs to sensitize women on safe choices. ZAGO is also carrying out different research, okay, in different fields. And then also we're not just focused here in Lusaka where women have access or people have access to TV or social media and whatnot. We're also going out into the communities, to the grassroots, to sensitize the members of the communities, to sensitize the community leaders on issues that are causing maternal mortality.
So when you talk about the age group that's fertile in terms of being pregnant, because I think we are looking at the age group from 10 to somewhere, is it 35?
Okay.
Somewhere there. So do you also sensitize the young ones, the adolescents, on maternal mortality? Because putting in consideration, these are people who are still in school, some of them primary, they're still doing their primary education. Do you also reach out to them? Because we have the issue of teenage pregnancies as well. So how do you go about that?
So first of all, thank you, Timenji. I want to start by saying that 10 years is not a reproductive age group.
But doc, we do have young
Yes,
ones who are
yes, yes,
pregnant
yes, of course. We do have,
at that age.
we do have people less than 18 getting pregnant. And in an ideal environment that should not occur because you should be focusing on your studies.
Yes.
However, that's not to say that the young or the adolescents who are coming in pregnant are not being sensitized. Like I mentioned, we work hand in hand with the Ministry of Education to carry out these sensitization programs. We work hand in hand with peer groups. We work hand in hand with different youth groups to try and sensitize these age groups on the importance of safe choices. By that, what do we mean? Now, when you're talking about prevention of a pregnancy or getting pregnant, rather, is you start at the primary route. Or you start from the primary route where you're going to first of all advocate for abstinence. Okay, most importantly, you are in school. Can you focus on your studies? Can you focus on bettering your life? So we do discuss issues to do with abstinence. Like I mentioned, safe choices. By safe choices, we're not just talking about safe abortions. No, we're talking about prevention of the pregnancy itself. If you're already sexually active, what measures can you put in place to try and avoid getting pregnant at a tender age? Because teenage pregnancies carry a very high risk. Like we mentioned earlier on, this is a girl whose body is not well developed. She's a child herself. Physically, mentally, and psychologically, she's not well developed to carry that pregnancy. So then what measures are we putting in place? We're advocating for this, or we're sensitizing these girls to abstain. If they're already sexually active, we're sensitizing them on the use of safe sexual practices such as barrier methods, condoms. We're sensitizing them on the issues of family planning. If you come to a hospital, you're a girl child who's like 16 years old and you want to seek family planning services, no one will send you away because you're young. You will be cancelled, and then at the end of the day, you will be helped to prevent a pregnancy from occurring, which could potentially lead to adverse effects.
So just on that, as we are talking about adolescents now,
Mm-hmm.
what's the picture there when it comes to maternal mortality when you're looking at adolescents?
I'll still go back to say that, because of the poor health seeking behavior, you find most of in the younger age group, there's a high practice of unsafe abortions.
Yes.
Okay, which is the area that we are really interested in when it comes to sensitizing the public to say, okay, once you get pregnant and you are not able to carry this pregnancy to term for various reasons, you can easily come to the hospital and you can be helped. By help, I'm not saying you will be offered an abortion, and then that's not our message here. You can be helped to carry this pregnancy to term if you want to, and you can be given options, or you're given options to decide whether to go back home with that child or to put up this child for adoption, or better still discuss with your relatives what the possible options can be for the child. So yes, we are sensitizing. We're trying by all means to put across this message to the community to say, look, you don't have to carry out these unsafe practices that would potentially lead to your death. Come to the hospitals, we're there for you. Yeah.
Do you think early marriages is also one of the most contributing factors to maternal mortality?
Yes,
How so?
I do think that early marriages are one of the contributing factors to maternal mortality. Like I mentioned, Timenji, you find a girl who's 13 years old has been married off. She's literally a child herself. Okay. Then she gets pregnant. Then she develops complications during childbirth that would potentially lead to bleeding, that would potentially lead to uh, the bonds breaking, that would potentially lead to her rupturing. All those are problems that can be avoided. And I think I would like to recommend my people in the Eastern Province for the stringent measures they've put in place to try and curb these early marriages, which is a good practice. I think instead of our parents focusing on marrying off these young women, it's important that they focus their energies on allowing these girls to go and have an education. So yes, it's up to you and me and everyone else who's out there to ensure that we support these young girls. Okay, and I think I'm happy with the measures that the government has put in place of the return policy. So you fall pregnant and they allow you back into the community. But most importantly, I'm happy with the laws that they've put in place to say if a mother marries off a child who's young, they face the consequences of the law.
Exactly.
Yeah.
So you just mentioned that you've got different stakeholders
Yes.
trying to address this problem. So how's been the feedback so far?
I think the feedback has really been overwhelming. Like we can see already with regards to prevention of unsafe abortions, I think currently we're at 7% from 13%. And I think that on our own as ZAGO or as Ministry of Health would not have managed to do that without the help of our stakeholders. So yes, we are still a long way from taking this message out into the community, but so far we're on the right track.
The feedback is
The
positive.
feedback has been positive.
Okay, that's something really interesting to learn. So, Doc, we have a message right here. This is Mr. Mwale texting from within Lusaka, and he's asking to say what other NGOs is ZAGO working with to address different problems that the organization ZAGO wants to address.
Okay. I thank you so much for that question, Mr. Mwale.
Yes.
Okay. Mr. Mwale, thank you so much for that question. Currently, at ZAGO, we have different stakeholders and different NGOs. I won't mention their names, but I want to mention that there are a lot of groups. For example, we're working with youth groups, different youth groups and different organizations that are involved in youth programs. We are working with the Ministry of Health. We're working with religious organizations. And also we're working with other government organizations. So yes, we are not working alone. We are working with a lot of stakeholders, and we're grateful for the support that the stakeholders are bringing on board. But most importantly, we're also grateful for our supporters, ZAGO, because we're currently funded by FIGO, which is the Federation of Gynecologists and Obstetricians. So we do have at a local level and also at an international level a lot of NGOs that we're working with.
Okay. Another question from our viewers is, Doc, you just mentioned that you distribute condoms in the view of addressing this problem. Don't you think that's encouraging the young ones to go about to misbehave and also to have teenage pregnancies? As a result, we have the high numbers of maternal mortality. This is Mr. Zulu from Petauke.
Thank you so much, Mr. Zulu, for that contribution. I was saying that as ZAGO, one of the things that we are doing, or the sensitization campaign that we're carrying out, is called Zambia Prevention of Unsafe Abortions, or in short, Safe Choices. So by safe choices, like I mentioned earlier on, we are not encouraging girls to go and get condoms in order for them to start practicing sex. What we are doing as ZAGO is to ensure that every woman is aware of their health reproductive rights. And how are we doing that? Yes, of course, we are aware of the fact that these young girls are supposed to be abstaining, but also we are aware of the fact that there's nothing we can do about the girls who are already actively involved in sexual practices. But how best can we help them? We want to ensure that these women have got, by the way, we're not out there to distribute the condoms. We're working with different organizations, one of which is the Ministry of Health. And you will note that the Ministry of Health is actively involved in distributions of protective equipment, such as the condoms themselves, not only to prevent pregnancies, but also to prevent unwanted infections, such as HIV/AIDS, such as sexually transmitted infections. So yes, we will not dispel the fact that these young girls will potentially become highly promiscuous, but our job is to ensure that those consequences of these unsafe practices that would potentially lead to maternal mortality are reduced, which is our message. We want to see a country where our women are healthy. We want to see a country where our women do not end up with complications. Imagine, Timenji, today, if a girl were to get pregnant and she carried out this unsafe abortion without any complications. But then there are also long-term complications that can occur because of that. This girl can end up failing to have a child when the time for her comes to have a child. So if we can give this girl a condom to prevent her from getting this unwanted pregnancy, or to prevent her from getting this sexually transmitted disease, or to prevent her from getting HIV, why then do we want not to distribute these things? You see, so it's a matter of a public health concern. That's why it's important for us to understand that whether we like it or not, these practices go on in our communities. But what role do I have as an individual? What role do you have as an individual to try and prevent these things from occurring? Thank you.
Okay. We have yet another question, which reads, thanks, Doc, for the good explanation of many issues affecting our communities. My question is, what is ZAGO doing to reduce maternal deaths in rural areas? Are you also in rural areas? If so, what messages do you share with them? This is a resident from Lusaka.
Okay. Thank you so much for that question and contribution. So ZAGO is Zambia Association of Gynecologists and Obstetricians. So this association is an association that oversees the practice of obstetricians and gynecologists who are members of the Ministry of Health. Okay, so then what measures is the Ministry of Health and ZAGO putting in place to ensure that there is a reduction of maternal mortality and death? Not long ago, I'll just give an example of one of the few things that ZAGO is doing through its educative means, or rather through its association with stakeholders to reduce maternal mortality. We recently had a meeting to Kasama where we invited people from the different rural areas. These included the traditional birth attendants, it included the SMAG people, it included health workers, it included the chiefs, it included the traditional healers, it included all sorts of stakeholders found in these rural areas to try and put across this message that would potentially lead to the reduction of maternal mortality and morbidity. So we are not working on our own as ZAGO. No. ZAGO is not an independent association, or it's not even a Ministry of Health. No, it's an association that governs the practice of gynecology and obstetricians who are members of the Ministry of Health. So with that being said, we are also carrying out different researches to try and see which areas are highly affected and what measures can we put in place through the knowledge that we are getting through our research to reduce maternal mortality.
So at the moment, we don't know which area has the highest number of maternal mortality.
We did mention that the area that has the highest number of maternal mortality is basically that of postpartum hemorrhage or postpartum bleeding. But then also the other area that we have focused on, which really, in as much as we try to hide that these things do happen, is that of abortions. So you find we're carrying out these sensitization methods, and we're carrying out also research, and there've been researchers that have been done to try and see how best we can sensitize our people to try and prevent these unsafe practices.
So you put an emphasis to say, I'm really interested in this area where you kept on emphasizing that our women should be coming to health care facilities as even before they get pregnant. So just in that area, how does ZAGO intend to improve, like to help the women improve in that area, just on the women, the behavior that they have of maybe coming to seek the services maybe when they are at 5 months pregnant? How do you intend to do that? Because it seems that's one of your biggest concern, because you kept on putting an emphasis on that.
Yes, thank you, Timenji. So yes, I did continue to put an emphasis on that. And what is ZAGO doing about it? I think this is one of the programs that ZAGO is carrying out, and us discussing the importance of preconception care. But besides that, I also want to mention that ZAGO is educating different healthcare practitioners in the specialty or in the practice of maternal health and maternal and child health. Okay, so they are doing so much. they we're already an association of obstetricians and gynecologists, but we are not just working alone in isolation, because like I mentioned earlier on, if you look at the doctor patient ratio, it's very high. But then prevention of mortalities occurring because of pregnancy related conditions is not something that only the doctors can achieve. Okay, it's something that would require other health practitioners to join in. So we have a lot of other members. We have the nurses, we have the midwives, we have the pharmacists, we have the pediatricians. So we have all these different groups of health workers coming together to work for the betterment of our women.
Okay. So, Doc, as we are almost coming to the close of the program, uh, what could be your few closing remarks?
Thank you, Timenji. So my few closing remarks would be to emphasize to our women that this fight is not a fight, or not just to our women rather, but to our viewers and to our families out there, to say, maternal mortality is something that affects everyone. If it doesn't affect you directly, it will affect you indirectly. And I'm sure we all know of one or two people that have died during the process of childbirth or shortly after childbirth. So it's important, and it's also imperative that we as a community join hands and forces together to try and reduce this. How do we do this? By improving our health seeking behavior, by coming to the hospital as soon as you identify you're pregnant, or better still, coming to the hospital even before you're pregnant, by ensuring that if you have risk factors that could potentially lead to a death, you come into the hospital as soon as possible. But also, most importantly, by practicing safe choices. I think it's through safe choices that most of our problems can be avoided.
Okay.
Thank you.
Doc, thank you so much. It was interesting and nice to have you here. We hope we'll have you again. To our viewers, we've come to the end of our program. Please remember that we are here every Sunday from 20 to 21 hours. Please put those reminders, and also you can continue interacting with us on our Facebook pages, which is ZAGO or even KBN TV, and also YouTube channels. I'm your host, Tumenji Chinjili. Till next time, it's bye-bye. It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks